Hi, my name is Dr. Alicia Nero. I am a hematologist in the Sickle Cell Program at Children's Medical Center and UT Southwestern Medical Center. I want to tell you about a medication called Hydroxyurea. You may have already heard about it, but we're using this video to spread the word. Hydroxyurea is the only medicine that can prevent problems in people with sickle cell disease, and that's in both children and adults. Hydroxyurea is taken by mouth once daily, and in people with sickle cell anemia who take this medicine, it has been shown to greatly decrease the number of pain crises, as well as decreasing acute chest syndrome, which is a severe lung problem similar to pneumonia. It also decreases hospital admissions and the need for blood transfusions. In addition, it improves the anemia associated with sickle cell disease and improves the quality of life. Importantly, adults who take hydroxyurea live longer than those who do not. Hydroxyurea has been studied in people with sickle cell anemia of all ages, including babies as young as 9 months. It appears to be both safe and effective. You may wonder why, if hydroxyurea is so great, are we not just giving it to everyone? Well, in fact, the Sickle Cell Program at UT Southwestern and Children's Medical Center Dallas is interested in expanding the use of hydroxyurea, and we're beginning to suggest it to most patients with sickle cell anemia. However, there are some minor side effects from hydroxyurea that you will need to know about. We will go through those in detail in your clinic visit.
I chose to start the hydroxyurea regimen because he was in the hospital constantly, month after month.
I started because last year in March, I came down with acute chest syndrome. And for any persons living with sickle cell disease, you know that acute chest syndrome is very, very, very scary.
My child, Travarius, has been taking hydroxyurea for about 1.5 years now. I choose to start it because they gave me some information about it, so I researched it a bit more, and then once I finished researching it and I found out that it was going to be better for him, I decided to take a chance on it. I'm glad I did.
My son has been on hydroxyurea for about 10-13 years.
For us as young parents, not knowing what's going on with our child, and him always in the hospital hurting until we came across the hydroxyurea, and it's definitely, like I said, decreased the amount of crisis dramatically, and it's kind of like a miracle almost.
Hydroxyurea has allowed me to keep my business. I have been out of the hospital and healthy since July of last year. It has been wonderful. I feel like I've gained some sense of normalcy with my life.
It's actually helped me with school a lot, especially school. I've been there every day with my attendance record intact, no absences whatsoever, and I haven't been coming to the ER not once this year, not once.
Taking hydroxyurea has really impacted my child because he's not as sick as he used to be. We don't have as many emergency visits as we was, and he's a little bit more alert than what he used to be.
I would definitely recommend hydroxyurea to other patients and families with sickle cell disease because it has worked wonders for our child. Since been on it, it decreased the amount of crisis dramatically.
I am the biggest advocate for this medicine because of how it's changed my life. I feel that people who are like myself, or anyone who does not want to be in pain all the time and who cherishes a normal, quote-unquote, normal life, they want to keep that life and make it as normal as possible. And hydroxyurea has helped me do that, so I recommend it to everyone. I strongly recommend hydroxyurea to everyone.
The one thing I would want families to take away from possibly using hydroxyurea is that if you're a working parent or you're going to school or anything like that, with this medication you really don't have to, worry about every month going back and forth to the hospital.
If you want to get good results out of this, it requires consistency. That means just, you'd have to take it every day, no exceptions.
To not be afraid. Of course, everyone is different, and And why not give it a shot? Because if it can change your life like it changed mine, and I know it changed many others, why not try something that has that kind of healing power?
Hi, I'm Dr. Tim McCabbott, and I'm a hematologist in the Sickle Cell program here at Children's in UT Southwestern. And I want to tell you about one important aspect of hydroxyurea treatment, which is laboratory monitoring. Hydroxyurea can decrease the white blood cell count and platelets, and because of that, it's important that we monitor your blood count once a month when you're on the treatment. We'll work with you to determine whether the lab at Children's or a local lab is most convenient for you. We feel this is important to give you the most benefit from the medicine while keeping you safe at the same time.